30-year-old man comes to the clinic for follow-up 2 weeks after undergoing surgical repair of a 5 cm laceration on his left forearm caused by a bicycle accident. The sutures were removed at his last visit. Today, the incision appears clean and well healed with no signs of infection. The patient works as a construction laborer and asks when the healed area will be as strong as it was before the injury so he can safely resume heavy lifting. Which of the following is the most accurate statement regarding the eventual tensile strength of the healed wound? Choice A, it will return to full strength after approximately 6 weeks. Choice B, it will return to full strength after approximately 6 months. Choice C, it will return to full strength after approximately 1 year. Choice D, it will never regain its original tensile strength. Or choice E, it will exceed its original tensile strength due to collagen remodeling. I'll wait 5 seconds and answer the question. So this is just one of those fun fact kind of questions where you need to know that scars are similar to healthy skin and that they largely consist of type 1 collagen, but the organization of those type 1 collagen fibers is less organized in scar tissues, so it will only ever reach about 80% of the original skin's tensile strength. So choice D, it will never regain its original tensile strength, is the correct answer. The other answers, choices A through C, are pretty much just arbitrary amounts of time as far as how much tensile strength has recovered goes. I don't think they actually expect you to know that on USMLE. Although occasionally they do like to test on the general progression of wound healing, so I'll just go over that real quick. Early wound healing takes place over days. You have platelets and clotting factors helping to stop bleeding at the wound site, and neutrophils and inflammatory cells will enter the tissue to kind of clean up antigens and cellular debris. The proliferative phase occurs over days to weeks. Glycoproteins and mucopolysaccharides, as well as type 3 collagen, gets deposited into the tissue, and the keratinocytes will divide to help re-epithelialize the wound. And then the remodeling phase takes place over weeks to months, where the type 3 collagen that was deposited earlier will be largely replaced by type 1 collagen. And as mentioned before, even though healthy tissue also is mostly consisting of type 1 collagen, scar tissue is far more disorganized in its arrangement, and therefore it will never recover to its full strength. And I guess just as kind of a bonus fun fact here, the Dupuytren or Dupuytren contracture, I'm not sure how to say it correctly, that is actually due to an overgrowth of type 3 collagen as opposed to type 1 collagen. And it just leads to stiff tissues in the affected area, which is why you get the contractures or your fingers might be flexed. Anyway, like I said, as far as this question goes, it's one of those fun fact things that you just kind of have to know. They test on it every now and again. Scar tissue just never gets back to the full strength that normal skin tissue has. I hope you found this video helpful. See you in the next one.